Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Every 3 minutes, a child is diagnosed with cancer somewhere in the world. That's according to WHO's Global Childhood Cancer Initiative report. Now think about this. For us in Africa, the survival rate is less than 20% as compared to 80% in other worlds, the high-income countries. Now stay tuned as we uncover childhood cancers and the role you need to play in this fight against childhood cancers. You do not want to miss this. Greetings and welcome back to yet another transformative episode of the Healthy You program. This is your favorite health program on Faith Today Television. My name is Enock Kitondekijja, your host, and I'm so proud to walk this journey of health, healing, and transformation with you. A special thanks goes to JCK Hospital. These are our darling sponsors. They make this program possible. And mind you, they are the leading advocates for health for the body, mind, and soul. Refuse to get stuck anywhere in your pursuit for health. You can reach them using that number on your screen. And again, JCK Hospital College of Health Sciences has good news for you. Allow me to say this. They're having their free first aid training happening this very Saturday. You do not want to miss. Back to our topic. Today's discussion is one that we should have had earlier. We are in the month of childhood cancer awareness. We want to talk about the war that is ongoing against childhood cancers. The question is, what is your role? What do you have to do as a family? What is your part in this? And to help us unpack this peril is no other but an expert, a pediatric surgeon, a man we've had on this platform before, the very fit person to break this down for all of us. He's also from JCK Hospital again, our bona fide partners. But before I invite him to take us to the next level, I'm aware of those of you who follow us on social media. You do so well. And I want to remind you to please subscribe. If this conversation makes sense, go ahead and share with as many people as you can, because we need to end this war today. Back to my guest, Dr. Mugo is back to Faith Day Television. Happy to see you.
Thank you so much.
How has been your week?
My week has been fantastic. Thank you for asking.
I see you on TikTok. I see you everywhere, bringing awareness to our community. What fuels that passion? Why are you so passionate about your thing?
So, thank you for that question. So, as you introduced me, I'm Dr. Robert Mugo. I'm a consultant pediatric surgeon working in Nairobi. I work at JCK Hospital and various other hospitals around Nairobi area. And I'm very passionate about this, social media and advocacy, because as I continued my practice, I realized that there is a big gap, which is awareness, that patients are not aware that, such diseases occur in children and that early recognition and treatment is available. And that's why I go on social media. I try to educate parents. I try to educate, the public about, various conditions where a pediatric surgeon can come in handy and help out the child.
As you've heard, ladies and gentlemen, he only gives his expertise on social media, but it is always just bits and pieces. Today, we have him right here on Faith Today Television. You do not want to miss to engage him personally, and we have that number on your screen. In case you have any question, please let it come in right away. And this, the earlier you do, the better. Use that number, send in your questions so that we can be able to answer you. And actually, I love your passion and your energy, and I believe that is why we have you back on Faith Day Television. We appreciate the work you're doing out there. There's a challenge of childhood cancers coming up. You've heard the statistics globally. It is serious. Every 3 minutes, a child is being diagnosed. So we want to begin with clarity. Help us understand what is these childhood cancers and how do they typically present. You could also help us understand the difference with, the adult cancers today.
All right. So, childhood cancers, you've heard the statistics. Worldwide, a child is diagnosed with cancer every 3 minutes. In Kenya, the statistics we have available are that this is something that 3,200 children are diagnosed every year in Kenya to have childhood cancer. Now, this number seems high, but in essence, it really represents a lot of missed diagnosis. Because remember, the majority of the population in our country are actually children. And we are only picking 3,200 of them with cancers. This means there are a lot that are going undiagnosed. Now, childhood cancers are a bit different than adult cancers. So in both cases, a cancer are cells that are multiplying very rapidly, uncontrollably. And now these cause the various symptoms associated with the different types of cancers. So I will unpack it in this way. Childhood cancers just occurs as a result of, a genetic mutation. So in the cells, as the child is growing, the child grows. As the child is growing, something goes wrong in the genes of one of the cells somewhere in the body, and this cell starts multiplying rapidly. And because this is just a genetic accident, this means that it is not the fault of the child or the parent. It is just something that has occurred. Again, childhood cancers are rare. When you compare to adults now, a lot of cancers are linked to lifestyle choices. So things like smoking, alcohol use, your diet, sedentary lifestyle, occupational exposures in the workplace, so exposure to hazardous chemicals, and then chronic infections, so things like HPV, human papilloma virus, or hepatitis virus. So those are what cause most adult cancers. But in childhood cancers, it's just a freak accident. So the message that I have here today is, as we talk about these cancers, I want to raise awareness that yes, this is a disease, that cancer is also a disease that occurs in children, so people should be aware. We shall also, we shall be raising awareness on the common symptoms to look out for, because when these cancers are found early, the treatment is much more effective. And indeed, a lot of childhood cancers are completely curable, and the child will go on to live a full and normal life. And that is why we are here today. So these are some of the things we shall be talking about.
I think you begin by also giving me a bit of hope, when you talk about it being manageable, because when people feel or even hear about cancer, they know that it's a death sentence.
Yes.
But when you give us hope, that also, I'm sure people would want to know how that hope comes into play. But before we get into that, could you help us understand what are the common cancers, childhood cancers we are getting, and also tie it into, you talked about accidents, genetic mutation and things like that.
Yes.
The current world we are living in, what are some of those exposures that these children get that we need to know? Thank you.
All right. So the commonest cancers in children, these are statistics presented from all over the world in centers that treat childhood cancers. So the commonest cancer will be cancer of the blood. So these are leukemias. That's the commonest that occurs. Another very common cancer is a brain cancer in children. Then the third most common will be a cancer of the lymph nodes. These are called lymphomas. The fourth most common cancer is a cancer of the kidney, a Wilms tumor. Then this is followed by a cancer of the muscles, which is called rhabdomyosarcoma. And then finally, bone cancers or osteosarcoma. So the names sound a bit strange, but in Greek, it's actually just a direct translation. It means cancer of the bone, cancer of the muscle, like that. And you can see as I'm going through the list, these are indeed the cells or the organs that are multiplying quite rapidly in a child's body. And this is what gives the opportunity for a genetic accident to occur. So it's not really linked to an exposure in children. Okay. So these are the cells. So you've seen, as I've gone through the list, these are the cells that are growing very fast in a child's body. So you have blood cells, you have the brain that's growing rapidly, you have muscles, you have bone, you have the lymph nodes, you have the kidneys. So you can see this is why actually it makes sense that these are the most common places where cancer will occur in children. Okay. And as we go through this topic, we shall be talking about the common symptoms to watch out for. And when you recognize this early, you bring in your child so that we can screen, and if found to have cancer, then actually the treatments modalities are available and very effective. Remember that children have actually very healthy organs. They don't have any other disease. Probably they'll only have the cancer affecting them. And this means that they can withstand the quite intensive treatment that is needed. Because we know that cancer needs very intensive treatment, and children can be able to withstand this treatment much better than compared to an adult, somebody who's elderly and other organs have other problems. And this is actually what brings the much higher success rate in the treatment of childhood cancers.
That means in the outside countries, the high income countries.
In the high income countries, yes. This is what, and even in Kenya for the ones who complete the treatment course.
Okay.
This is what brings about the much better survival rate of childhood cancers as compared to adult cancers. So indeed, childhood cancers are not just manageable, but indeed completely curable if we find them early and treat them appropriately.
Completely manageable. That is a key word that you need to understand today. From whatever we are hearing from the doctor here, he is giving us hope that cancer in children is not a death sentence. There is actually much more hope to get it abated if you have been able to understand, pick it early. I hope your question has come in. We are using that number on your screen. And remember, this discussion is brought to you by none other than JCK Hospital. You can find them in Orisambu along Lumumba Drive, just next to Happy Life Children's Home, or opposite Park University. Daktari, let us engage now the gears.
Yes.
Because I believe my viewer out there is wondering what are some of those red flags we need to catch so that we don't delay, like you've alluded to the fact that if you delay, the outcome is a bit bad, but if you come early, you can be able to help us, sort this.
Okay.
Yeah.
So my key message that our viewers should take away on the red flags will be the duration of symptoms. So chronic symptoms, okay, that is the number one thing to watch out for. So symptoms that are lasting more than 2 weeks without a clear explanation. Because children get sick very often. They get a cold, they'll vomit, but these will come suddenly, and with appropriate treatment, the symptoms completely resolve. So if your child is having any symptom in particular lasting longer than 2 weeks and not resolving in appropriate treatment, this is the first sign that you should probably seek an opinion from a doctor. Now, talking about particular symptoms, what are the symptoms that you should be on the lookout for? First is a lump appearing somewhere on the child's body that is growing. The lump may or may not be painful, okay? But this lump will appear suddenly on the child's body and will keep growing. The lump may be on the neck, on the armpit, on the groin, or sometimes in the abdomen. When you're washing or you're changing your baby, then you'll feel that, there is some swelling you can feel in the abdomen. This should prompt a checkup with a doctor, okay? A second symptom is if the child just has low energy, so they are not as playful as they were before, they are not as interactive, they get tired easily, This is a common sign of anemia, which is a common sign that this child has low blood cells. Again, leads back to the cancer of leukemia. So loss of energy. Okay, child is not as playful. This child is having repeated infections or fevers. You don't know where they're coming from. Every week, a new fever, new infection, back to hospital all the time with infections. Get this checked out. This child is bleeding and bruising easily. So, children in the course of their playing, they'll fall down, they'll bump against something. But normally, in most children, these are minor and trivial injuries. They don't lead to bleeding. But now, in these particular children who have cancer that is causing a disorder of the blood, a small fall will cause them to bleed. Or a small fall, you'll find them having a big bruise. Get this child checked out. If this child is having persistent headaches, especially early morning headaches, and associated with vomiting. So first thing when they wake up in the morning, headache, day 1, day 2, day 3, headache associated with vomiting, first thing in the morning, and may also be associated with other symptoms like sudden loss of coordination. So these are child who knew how to walk, jump, play, and suddenly they can't walk anymore. Vision or hearing loss, or even convulsion. Get this checked out immediately. And finally, you have this child who's complaining of bone and joint pains all the time, not associated with any activity. This is not relieved by rest. It wakes up the child at night. So, of course, sometimes children maybe fall down or they have this thing called growing pain, but these are usually minor pains, easily relieved by medication, and its pain is not usually severe enough to wake the child from sleeping. If they're having such kind of bone, joint pain, especially also associated with swelling, the affected bone and joint, then it is time to see a doctor. So these are some of the common red flag symptoms that you should not ignore. And the importance of knowing this is childhood cancers, unfortunately, grow very rapidly. So this is not something that you can ignore for long. Adult cancers, you might have, might feel a lump somewhere. You might be having some difficulty urinating, some difficulty passing stool, might feel a lump in the breast, and you can ignore it for a few years before it really becomes obvious. But for a child, if you ignore this within a very short period of time, because unfortunately a lot of these cancers are very fast growing, then the child becomes very sick very fast and treatment becomes more challenging.
I was so fast, but now I get to step down, because when doctor here tells me that yes, they are treatable, but they are also growing very rapidly, as a parent, you don't want to take any chances.
Exactly.
Having this information, Daktari, is very, very timely, I believe, and it's exciting. Again, I want us now to get a bit deeper in understanding, because now I feel there is a bit of urgency. So help us address some of the gaps. Where are the gaps? Why is there a delay right now? Because you say most of the children present when it is a bit late. So why are the delays? I mean, is it because of awareness? Is it in the gaps in the healthcare system? What is the cause of the delay?
So there are many factors at play. And remember, at the start of the discussion, you said in this country, we're only picking 3,000 children who are presenting late. It means we are missing very many who have not even been diagnosed.
So that's a gap.
All. That's a huge gap.
Good.
So why does this gap come about? Number one is lack of awareness. So you see, these symptoms that I've described, most people are not even aware that childhood cancer is a thing. They think that this is a disease of adults and the elderly. They do not regard children as possible that children can get cancer. So there is a big gap in awareness. There is a big gap in the symptoms of childhood cancers. So you'll find that these children, even by the time they are presenting to us, they have been seen at so many other places and treated for so many other things without improvement in their symptoms. And now when the cancer now is fairly obvious, there is a huge growth, a big tumor. Now that is when they are finally coming to the attention of a specialist. So there is a lot of delay in diagnosis. As well, there is challenge in accessing diagnostic facilities. So, in order to diagnose cancer, you need special equipment. You need, and also specialized services. So you need specialized doctors. So doctors who specialize in taking care of children with cancers, who can be able to suspect and pick up these symptoms early. You need support of other services, such as the laboratory. So when you take the sample, it's taken to the lab, and then you can find out exactly what type of cancer it is. So specialized services like laboratory, specialized services like imaging. So often you need specialized imaging like CT scan, MRI, PET scans. And again, these are not widely available across the country. So patients have to travel far to access these services. Again, we know that in Kenya, this is a developing country, third world country. So the financial burden is quite considerable on families. And the financial burden starts even from the point of diagnosis. So you need to, in order to get the diagnosis of a cancer, these are expensive services. You need imaging, you need lab. And then again, the treatment is also quite expensive and prolonged. So unlike for an acute illness, let's say if you have pneumonia, you'll be given antibiotics for a week and you're fine. But cancer treatment is a journey that takes months, okay? And we know a lot of the population is not insured. And this means that all these costs are borne out of pocket. And what this means is that a lot of the families cannot even afford to have the illness diagnosed. And after it's diagnosed, they cannot afford the full spectrum of treatment, which often involve things like surgery, chemotherapy, special drugs, radiotherapy for a long period of time. And these are quite expensive. So these are some of the main barriers to diagnosing and treating cancer in our country. And that's why, our statistics are as they are. But these are all things that are fixable. And since, these are the things that we need to work on now so that we can give our children hope and a future. That cancer is not a death sentence. In the developed world, cancer is not a death sentence.
Okay. And
the same is possible here in Kenya.
So it is possible right here in Kenya. For those of you who are just tuning in, this is the Healthy You program that is brought to you by JCK Hospital. And JCK Hospital College of Health Sciences, again, right here in the heart of Nairobi, is offering a free training for first aiders. Yeah, so you're a caregiver, you are a stay-home person, you need to make time. You have a house help who needs this information so that they can be very effective in, giving assistance. Remember, it is free of charge. That is the tagline. It is free of charge, and it is brought to you again by JCK Hospital College of Health Sciences. And those of you who are tuning in today, we are having Dr. Mugo, an expert. He's becoming viral. I mean, he's trending on TikTok talking about pediatric issues. Today we have him in the building and you would want to engage him personally. So using that number on your screen will be very helpful. I hope you've sent in your question. And we learned today that when we're dealing with cancers in children, it may not be so obvious. That means you may not take things lightly. He talks about, leukemia, that is cancer of the blood, He talked about the bone cancer, he talked about kidney being affected, and then those small swellings. Yeah, he talks about things that affect the lymphatic system. You may not understand the science, but whenever you see something unusual, he is stressing the urgency that you need to see the doctors. You need to come so that they can diagnose and help you understand. Now, that is on your end, daktari, on your end. You see there are gaps, people are missing these cancers. Why is that? So are there any challenges that you guys might be going through in the health facilities? Because before we go to the other stage of the diagnostics, this health center 1, 2, 3, what should they focus on so that we help these people?
Okay. So speaking from a medical perspective,
yes.
First of all, we know that treatment of childhood cancers is not something that is done by one professional. This is something that is done by many health professionals, or what we call a multidisciplinary team. So there are many doctors who are involved. So the first challenge will be bringing these doctors together at one place. Okay. And this happens in this country, starting to happen more and more. We're having more and more so-called treatment centers or centers of excellence. For now, they are in the big cities, Nairobi, Mombasa, Kisumu. That is where you will find centers that have enough of these specialized doctors. And the team, let me talk about the team. So what is the team that's involved in treating childhood cancers? So you need to have, number one, a pediatric oncologist. So this is a pediatrician who has further specialized in the treatment of cancer using medication. So these are the people who diagnose the cancer and administer the chemotherapy. Then they might be aided by pediatric surgeons like myself. So where does a pediatric surgeon come in? So we might be called in to cut out the cancer, if applicable. We might be called in to help in the diagnosis. So sometimes we are the ones who obtain the samples and send them to the lab. And also we might be asked to offer other supportive services, like we are the ones who put in the lines through which chemotherapy is administered. We know these medications will be administered for a long time. These are quite toxic medications, to be honest. They cannot be taken orally. They can also not be given using an ordinary line. So you have to put in a big line into a major blood vessel that will sit in the body for a long time. So these are called chemopods. And as pediatric surgeons, we are called upon to do such things. Sometimes these children will be very weak, not feeding well, so we can put in a feeding tube. Yeah. We might need to put in a tube to help them to urinate and other supportive care. Other very important people are nurses, okay? Pediatric nurses, especially pediatric oncologic nurses. So these are the ones who will actually mix and administer the medications. You need specialized pharmacy services, again, so to order, mix the medications. As opposed to in adults, you can say the treatment is like, one tablet. For a child, the treatment needs to be individualized, especially according to the weight. So this is something that pharmacists help us with. And then again, with the diagnostic aspect, as I alluded to earlier, you need a pathologist, so somebody who's specialized in looking at the tissue samples under the microscope, and then they can be able to tell, this is this cancer. They're actually the ones who tell us, this is the type of cancer that you're dealing with, and from there we know this is the best way to treat it. Again, you need specialized imaging services, so radiologists. So again, using the image, whichever part of the body, then they can be able to identify, yes, there is a growth in this part of the body, and they can be able to tell us how far it has advanced. So this is called staging. So you can be able to tell this is early cancer, or this is a late stage cancer, and from there we can be able to tailor the treatment modality. And then finally, we have things like psychosocial support. This is again very important because this is a prolonged treatment journey. It takes a psychological toll on the child, on the family as a whole. And any family that are dealing with a child with cancer needs a lot of psychological support as they go on their treatment journey. So for the health facilities, what I will say is First of all, just screen for these cancers, okay? Remember, childhood illnesses are common, but they will not be long lasting. So chronic, as we said, symptoms lasting more than 2 weeks, please refer this child to a center where they can be properly assessed. If the child is coming in, you're seeing them every day, infections, this lump that is not going away, these pains that are not being explained, they're not going away, weight loss that is not being explained, by malnutrition, you've taught them a regular diet, a good diet, but they are still not gaining weight, they're weak, they're lethargic. Please refer them to a center where all these people are, the expertise is available to have the proper diagnosis and the proper treatment.
Proper diagnosis and proper treatment.
Yes.
Very important. And then it's just getting better. This discussion is interesting, and I feel like the second part, because time is really running, and I don't want to lose any of you, because we are going to take a break, and when we return, Dr. here is going to handle the most critical part of this discussion. If you miss this, I don't know how to really help you. But for now, I know you're going to be tuning in. We're going to talk about now the preventive aspect of it, the practical steps you can take, the weapons you need in this fight, so that we can get over it. In the second part of our discussion, again, this is Faith Today Television. Do not change that dial.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enoch. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. All right, welcome back once again to our second segment. We have an expert in the building. Again, Dr. Mugo, our pediatric surgeon from JCK Hospital, is here helping us, equipping us giving us the weapons, the tools, the knowledge that we need to fight this battle against childhood cancers. Our children deserve a better future, and knowledge here is very key. The earlier you get it, the better for you and the better chances for the next generation. In our second part, we are going to be so practical, and I've seen your questions coming in. But before I get to respond to any of these questions, I want Dr. here to help us also understand about the steps we need to take today. I know your questions are coming in, but before I lose any of us, I want us to understand the steps, what you need to do as a parent, as a caregiver, so that we are able to identify, catch these cancers, so that we do not get into the business of spending, treating. Daktari, help us in that segment.
Thank you and welcome back. I hope you've been following from the previous segment. So why are we talking about childhood cancers today? This is because we know that childhood cancers represent the third leading cause of mortality. So they are the third leading cause of death among children in our country, just behind infections and complications of prematurity and congenital anomalies around birth. So after those two, then cancer is the third leading cause of death. But again, this is not a message of doom and gloom. Again, as I've come to say, childhood cancers, if caught early, are very treatable and indeed completely curable. So today, this is where we are emphasizing the message of early detection. Okay. When it comes to the preventive aspect of it, unlike in adults, adults, as I've talked about before, cancers will arise from lifestyle choices and exposures. And these are things that take very long. They take a very long time before a cancer will arise. So somebody will have smoked for, 20, 30 years, finally get, lung cancer. But in children, cancer is a result of a genetic mutation. Okay?
Yeah.
So not something that you can really prevent as a parent. It's it will be an accident or a freak of nature. But when it happens, and that's why we're here today, you need to learn to recognize it early and bring your child in early for evaluation, so that if we find that it is a cancer, and most of the time it will not be a cancer, okay, but in the rare event that we find it's a cancer, we can start the treatment journey early. And we've gone through the symptoms. So symptoms more than 2 weeks, symptoms lasting for more than 2 weeks, especially any lump appearing on the child's body, unexplained fever, recurrent infections, easy bleeding, loss of energy, weight loss, bone or joint pains that are not going away with treatment, headaches, frequent headaches, especially associated with vomiting, and other symptoms like dizziness, incoordination and loss of balance, or even convulsions, and these are lump or swelling that appears and keeps growing and growing. So this is what should prompt you to bring your child in early. Bring your child in early to a health facility for treatment. And if they are started on whatever treatment and it's not working, please go back to the health facility. Okay. And make sure that you get the correct diagnosis.
Correct diagnosis
Yes.
is very important because there is a gap in misunderstanding this and underdiagnosing.
Yes.
Because that is something that you have really helped us understand today. If something is not working, you're not getting any changes, get back to these people. They're able to help you. Daktari, we have questions coming in.
All right.
I don't see names here, but remember, as you send in your question, remember your name and where you're watching from, so that we can be able to help you fully. This is a discussion that you don't want to take lightly. The first question, no name, but I will take it. This is someone says, "Morning team, I am a parent and this really scares me. What are the earliest signs of childhood cancer that most of us ignore?" I think you talked about that. You want to emphasize?
Yes.
Okay.
So in response to, the question, so for parents, don't be scared. I'm not coming today with a scary message. I'm coming with a hopeful message. Okay. So first of all, childhood cancers are rare compared to adults. So most children do not get cancer. All right. And of those who do, if we catch them and treat them early, it's completely curable, and these children go on to live long and healthy lives.
Yeah.
And just to re-emphasize the symptoms that I've talked about, number one, chronic symptoms. So again, and really underline that for your viewers. Children often get illnesses, okay, but they are acute. They'll have a fever, 1-2 days, treated with antibiotics, goes away.
Yeah.
They are sneezing or coughing, 1-2 days, treated, goes away. They are having painful urination, treated, goes away. So symptoms are usually acute, and on proper treatment, the symptoms go away. But if symptoms are not going away, even on treatment, and the red flag symptoms, again, just to mention them, are a swelling or a lump anywhere on the child's body that appears suddenly and is increasing in size. The lump may or may not be painless, okay? So a painless lump should not be ignored. In fact, that is a very big red flag, okay? Number 2, we've talked about these headaches that are persistent early in the morning, associated with vomiting, associated with dizziness and incoordination. Number 3, I've talked about persistent low energy in a child. So this is a child who was previously playful, interactive, running around. And right now, they're just sitting in the house. They're not playing with other children. They appear weak. They appear pale, okay? They're having repeated infections, fevers, night sweats, They are having easy bruising or bleeding. So the child is just walking in the house, just falls, not even from a height, just, the normal childhood fall. And then you find there's a huge bruise on the leg, or they are bleeding from the gums.
Yeah.
This child is not gaining weight as expected. In fact, they are losing weight, and, they are eating well. It's not a problem of access to food. This child is eating but not gaining weight. This child is having these bone pains that are waking them up at night, okay? And they're not relieved by the painkillers and may be associated with a swelling around the affected bone or joint. So these are symptoms that should prompt a medical evaluation. These are serious symptoms.
Evaluation.
Yes.
And I like the emphasis you've said. I'm sure nobody is going to miss this. Today, we have a question from Joan Daktari. Joan from Thika here. Thank you, Joan, for following. She asks, does eating junk food or processed snacks actually increase the risk of cancer in kids? Because honestly, she's here being honest. She says, because honestly, that's what most of us give our kids these days.
So thank you, John, for that honest question. So junk food, generally, let me just say, generally, they're not very good for your child's health, okay? So try and minimize, okay? But we understand the reality. You're out with your child, you may not have carried fresh food, you buy them a snack. It's no big deal. Remember, the cancers that we've talked about are in the regions of the body that are growing very rapidly. And as I said, the main childhood cancers, just to go through the list again. Number 1 are blood cancers. Number 2, cancers of the brain. Number 3 will be cancers of the lymph node or the immune system. Number 4 is a cancer of the kidney. Number 5 is a cancer of the muscle, and number 6, cancer of the bone. Okay, so these are the commonest childhood cancers. So for exposure to junk food, this is something that really we're talking about adult. So for adults now, that is where lifestyle choices come into play. And lifestyle choices also need to be over a prolonged period of time. So prolonged exposure, 20, 30 years before a cancer can finally arise. And this is why now the commonest cancers in adults will be gastrointestinal colorectal cancers, from a diet now rich in ultra-processed fats, low fiber, and other chemicals in the food. 20, 30 years down the line, a cancer of the gastrointestinal or the digestive tract can arise, okay?
Yeah.
Prolonged exposure to, chemicals in the workplace, you're inhaling dusts, you're not wearing a mask, you might get cancer of the lung. If you are a smoker, 20, 30 years down the line, you will get lung cancer.
I like it when you talk about the duration.
Yes.
For us, the adults,
Yes.
it's a bit a long time. But for the children, they're not so. But also, it is a caution you are giving us, because these children are watching your lifestyle. They can pick a few behaviors, they go with them, and then it could also, they may not have the childhood cancers, but later have the adulthood cancers. I think that is important to emphasize. Again, doctor is not here to be a messenger of doom, but is giving us awareness. Again, this is a month of childhood cancer awareness. You don't want to miss it. If this discussion makes sense, please go ahead and share with as many people as you can. It can help your followers and someone will be grateful, I believe. Another question comes in from Emily. Thank you, Emily. Oh, let's get Liam first. I see Liam came in. So many questions, they are overlapping. I mean, people are really listening. Thank you. Let's take for Japheth. Japheth here says, if a child survives cancer, do they live a normal life after treatment? Or are there long-term effects we should know about?
Okay, so thank you for that very good question. So for most childhood cancers, they are, if caught early, okay, completely treatable, and this child goes on to have an entirely normal life, you know. So for instance, just to give an example, something like leukemia is treated only using chemotherapy, so medications, right? Given directly in the blood, and these medications will wipe out all the abnormal cells in the blood, and normal cells will start forming again, and you will never know that this child had leukemia. So the treatment course is quite hard, but afterward, this child goes on to have a full and normal life. Of course, for some of the cancers that I've mentioned, for instance, like Wilms tumor, a kidney might be removed, will be removed actually as part of the treatment course, but this is something that is not apparent externally, and a child can go on to have a full and healthy life with one working kidney. Some of the tumors, like bone or muscle tumors, might involve some sort of surgery, and in that case, even after you do the surgery to remove the cancer, there are many options to reconstruct. So this child will not be left with a permanent deformity or disfigurement. There are ways in which we can reconstruct using normal tissue and give this child a perfectly normal function.
A normal functioning.
Yes.
I love the confidence you have that you can give the child a perfectly. And of course, doctors are an extension of God's healing hand. So that is something that our viewers need to understand. The knowledge they have, empowered by God. All right, we have Mama Liam. Mama Liam, where are you? In Ruai, yeah? Thank you so much. She says, Dr. Ali, why does it feel like cancer cases in kids are going up? Is it something in the environment or just better detection?
Yes, so thank you for that question. For sure, the answer is that we are detecting these cancers better. So remember, as I said, these cancers in children are occurring as a genetic mutation in the cells that are rapidly multiplying. Cells in children are rapidly multiplying because these children are growing. You get, that's a basic biological fact. Children are growing, their cells are multiplying, and in that process, one or two cells, the process of multiplication goes awry, and these cells start multiplying too fast for the body to control. And now this is what manifests as a cancer. Right now, we are able to detect them better, and you know this is what is ailing the child. Probably in previous years, these children will just sicken. You know, maybe they'll be told that somebody has looked at them with an evil eye. That's why their abdomen is swelling, or that's why they are possessed by spirits. That is why they are fainting and convulsing in the street. You know, that is what these will be attributed to. Right now, we know what is actually causing them. But of course, as you've rightly mentioned, there is a lot of environmental exposure, you know, pollution, smoke, you know, the type of food that you're eating is not, you know, exactly organic, might be ultra processed. And this is definitely a concern. And exposure to these agents is linked to a rise in the incidence of cancer, but not in children, because you need prolonged exposure to these toxic agents. And then the cancer usually arises on later in life. But today we are talking about childhood cancers.
Today, we are talking about childhood cancers, but it's important that he gives that a background so that we know, because these are the people who are building our future, you know, this is a future generation. So if we do not have this discussion today, we may have issues in the future. Emily comes in again. She says, for parents who already lost a child to cancer, what kind of emotional support exists because that grief doesn't go away? I mean, from a pediatric.
Okay, so I'm very sorry for that, Emily. Very sorry for your loss. You know, this is a pain. Losing a child is one of the most traumatic events, and this pain never goes away. So, as we said, when it comes to walking the treatment journey, and this is where, again, I'm not talking about, you know, a particular treatment. It's actually a treatment journey that we walk along with the parents and the child who is suffering the cancer. So we are there as health professionals. We are there to support. We are there to offer encouragement. We are there to never lose hope. We do never stop treatment. We never say that this is a hopeless case, we can't treat. We always try our best. But we know, of course, that all in all, we are only human. We do not control fate. And sometimes, unfortunately, these children succumb to their cancers. So we do have grief support services. You have psychosocial support. And this is why I said treatment of children with cancer is not a one-man show. It's a multidisciplinary team. So we do have help with psychologists, psychiatrists, counselors. And I would say that for anybody who has a child who is undergoing treatment for cancer or has unfortunately succumbed, there are psychosocial services available, especially in the leading referral hospitals. So for Emily, I would urge you to seek care, talk to somebody, let it out. And the whole team is there to help. It's not that we'll abandon you in your time of need just because your child is no longer there. So we are always there to help. Come talk, come meet other parents who are undergoing the same thing, undergoing the same treatment journey. And we find that actually we are the ones who give each other hope. But again, very sorry for that.
I mean, I like your approach. You guys are very professional at this. You're from Jessica?
Jessica, yes.
Oh, Jessica Hospital. Again, thanks for the work you're doing, because having that multi-factorial approach is something that we need in our community today. Because in this battle, we learn that it's not a one-man show. There are people who can help you, people who walk the journey with you. And I feel that that's very important. In this role, it is a collective. There's a collective. We have the experts here. I mean, the doctors, the way they're doing their things, I think it's very important. But again, I think this is when you also help us understand what is our role as family members, people in the community. We're talking about a church. We come from a church, a background that even powers most of these things we are doing. What should we do right now as being the frontiers, the front line of defense?
Okay.
Yeah.
So again, this, especially in our country, this child, of course, is not in isolation. They are growing up in a community. They have their immediate family, extended family, and then the surrounding community, as you've said, the church, wherever they live. There are so many support services available. Okay.
Yeah.
So for us as community members, number one, remember the early warning signs. Always be on the lookout. Okay. Sometimes the parent may not recognize it, but you, let's say, a relative and somebody you might be seeing, there's a group of children playing, but there's one there who's not looking very okay. Or one time when you lift this child up and you feel something in the abdomen. So always bring this to the attention. Always bring this. If you see any early warning signs, bring it up for attention and help this child seek the healthcare facility, help from a healthcare facility as early as possible. Number two is just recognize that insurance is very important. As we've said, the financial treatment burden of cancer is quite considerable. And although even in Kenya, we rely a lot on, Harambe, fundraisers, whatnot. But if you have insurance, this can go a long way in offsetting these costs, because we know that the treatment journey is going to be long, it's going to be expensive. So we'll encourage a lot of the families, please register for insurance and pay for it. You never know when you need it, and it's better to have it so that when you need it now, you do not have to face catastrophic out-of-pocket costs. And we say these are some of the things that lead to delayed diagnosis or even abandonment of treatment, okay? Because, the family and the community might fundraise for the initial treatment, initial surgery. But now when you're told after surgery, you still have to do more chemotherapy and more radiotherapy, a lot of the patients disappear from follow-up with not so good results.
Wow.
And then finally now, if you're working the treatment journey with a family whose child has cancer, remember to be there to pray for them, encourage them, visit them, go see them in hospital. They are not there, they are just in hospital, but I'm sure they'll be cheered by, visitors from home. Give them an encouraging word. Sometimes you'll find that this is very common here. The mother has to leave, the other children at home and stay with this child in hospital for many months. So the surrounding community come in, ensure that the family at home is still well taken care of, so that even the parent with the sick child can really concentrate on the treatment journey without wondering what is going on at home. So a lot of support is needed.
It's very important.
Yes.
A lot of support is very important. And highlighting insurance, I think that one makes sense because, I mean, we have a show. It's a business program. It's called KBN every Thursday. Talk about business. People talk about cash flow projections, such things. People plan for business, but they never plan for their health. And that is very, very fundamental when you talk about planning for, I mean, your health as well, setting aside money for insurance.
Yes.
I think that is very, very, very helpful. We have so many questions coming in today. And again, as we give value, remember to subscribe to Faith Today television. If this conversation again makes sense, you know that people who can benefit from it, not just today, but tomorrow someone will be watching the show 1 year from now and so many years from now. But it will be very heartwarming to know that they got this conversation through your sharing. So that is something we cannot undermine. And those of you already doing it, we appreciate again. Thank you and God bless you. Daktari, so many questions are coming in. You're giving value. I have Miriam here. My name is Miriam, watching from Risambo. What role do genetics really play? Should we parents get tested before having kids?
Thank you, Miriam. So yes, genetics do play. As I've said, when it comes to childhood cancers, genetics are the most critical factor when it comes to childhood cancers arising.
Yeah.
Unfortunately, the human genome is over 40,000 genes, okay? There are some 40,000 genes. So widespread testing for genomic abnormalities is not feasible, at least as of yet with the current technology. However, especially for some specific genetic mutations that are known to occur, okay? There are some genes that we know definitely lead to early onset of cancer, but these will not be the cancers that I've mentioned. So for instance, there are genes that are known to lead early onset of colonic cancer, okay? And if an adult with the early onset of colonic cancer is found, an adult with early onset of colonic cancer can get tested and know that their offspring have a slightly higher risk of colonic cancer arising. So as well, adult with early onset of breast cancer, they are known cancer for breast cancer genes. They can get tested and they'll be able to tell that their offspring have a higher likelihood of developing breast cancer. But these are not cancers that will come up in childhood. Okay. So for now, anyway, to summarize, there are no really good genetic tests that will be able to predict that this person will have a childhood cancer. So genetic testing is not yet feasible. For some adult cancers, it is available, but even still, the presence of these genes causes an increase in the risk of a cancer arising still in the offspring in adulthood, not in childhood.
And I think when you talk about genetics, that is a subject we really need critical time to handle, because when you allude to mutations, those miscommunications that affect our genes in a way, that's a discussion you need to dig deep, because you highlighting it's the major cause here. It's a discussion that it should be ongoing, but because of time, we can't go any further. Unfortunately, Daktari, for now, let us have your parting shots and probably share your contact, because I know there are people who would want to interact with you personally, and this is the only chance they get from Faith Today television.
All right. Yeah. So thank you, first of all, is to say thank you to everyone who tuned in. So it's been a very great discussion, great questions, and feel free to continue this discussion later on in the comments. We shall read through them. We shall respond to as many questions as we didn't get to during the show. And my final message to everyone is this. Number one, childhood cancers are actually a real disease, a real problem. It's the third leading cause of mortality in children. But this is not a message of doom and gloom, because when childhood cancers are found early, they are very treatable, and indeed, many of them are completely curable, and these children go on to lead long, healthy, and productive lives. And my main message is early detection, okay? So there are red flag symptoms or symptoms that should prompt some alarm, and further evaluation from a health professional, especially prolonged symptoms. So symptoms lasting more than 2 weeks despite treatment, please seek advice from a health professional. And we've gone through the other red flag symptoms that you should watch out for. And now finally is to say that the cancer treatment, yes, it is intensive, it is aggressive, but in this country, we actually have a lot of those modalities are available. In years before, we would have to fly people, out abroad to complete some of the treatment, but right now the treatment is available. However, it is expensive. And this is why a very important point is to ensure that you have some sort of insurance so that when you need it, you don't have to face catastrophic financial expenditure. And now you'll be able to afford the prolonged treatment. And the services are available in this country. We have the professionals, the many professionals who deal with childhood cancers, from the pediatricians, the oncologists, the surgeons, radiologists, radio-oncologists. We have a whole team available in Kenya, in many of the big cities. And so a diagnosis of cancer should not be something that prompts you to lose hope. We are treating these children in Kenya. And for the ones who complete their treatment journey, we are getting very good outcomes. And the main reason why we are not getting as good outcomes as in other developed countries, mainly because these children are presenting late, so they come with advanced stage disease, and a lot of these children are not finishing their treatment because of the expense. So
right. Yeah, that's a good summary, and maybe we could have that number. If you don't mind.
So in order to continue this discussion, my contact is 0738 491 953. That is 0738 491 953. And you can also find me on my socials, Rob Mugo. So that's on Instagram, TikTok, Robert Mugo on Facebook. So find me on all my socials. I'm available and I'll be happy to respond to any childhood related questions.
Wow, that was really very detailed, and we appreciate, Doctor, your expertise. Thank you so much. Again, thank you, JCK Hospital, for making this program possible for our viewers. We have learned today that childhood cancers might be fierce, but they are not invisible. There is something we can do about it, and as the doctor has alluded to, the three major points. Awareness is very key. And then early detection is something you do not want to take lightly, because it will help. And then community action. It's a collective. All of us have a role to play. Your eyes, your sight, your advice, your recommendation will be very, very helpful. And again, we remember those who are following this program, and you're in hospital, you're home, you're getting any form of treatment. We want to encourage you and remind you that the doctors who are treating you are only an extension of God's healing hand. And today we pray and believe that your healing will come forth speedily. My name is Enock Kitondekijja, and you have been watching the Healthy You program. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.